Welcome to another edition of Mo Health Media. My name is Guy Danoff, and today we have actually a very special report. We're going to be looking at considerations for the flu season, and our special guest is actually Dr. Eric Armbrecht, and Dr. Eric is going to talk to us about some things that we should consider as we're now coming up on the flu season. And Eric, we know that you're a professor at St. Louis University, and you obviously are involved in the School of Medicine there. So I think the first question that we have to ask you, the flu season's upon us, why should we get vaccinated?
Hey Guy, thank you very much for the invitation to be with you today. This year, probably more important than ever to get your flu vaccination, or flu shot as we call it. Two reasons, right? Number one is that our healthcare system could be overwhelmed by influenza cases, right? COVID cases, and it'll be a rough winter if we can't reduce the burden on the healthcare system. So as we the flu vaccine will reduce the number of influenza cases that the hospital has to deal with, right? Which then opens up the hospital and gives it more capacity to handle COVID cases, right? And regular cases, cancer care, infections, heart attacks, all the other things that normally happen in any other year are going to happen this year too. So by reducing the number of influenza cases, we open up the healthcare system and reduce the stress on the healthcare system. But in a very personal way, we reduce the stress on our doctors and our nurses and our medical technicians. It's probably the first reason. Second reason is self-interest, right? So my first reason was you're doing it because you're a man or woman for others. The second reason is because you really care about yourself, right? So the symptoms of COVID-19 overlap with that of flu: cough, fever, fatigue, for example. And if you get those symptoms this winter, you're going to be presumed to have COVID-19 and have to isolate. The health department, your employer, the school is going to make you isolate, stay home, and separate yourself really until you can get a COVID test or until those symptoms resolve. So one of the most important reasons to get a flu vaccination this year is that there's a personal interest, right? If you don't want to go into isolation, do everything you can to prevent the possibility that you get flu-like symptoms, right? A flu vaccination is one of the ways that you can do that, in addition to other public health precautions that we're all already doing.
Well, Eric, thanks for answering that. But here's a bigger question now. Okay, that's great. We know that we've been doing this for years, and we're in a pandemic, and you've acknowledged that. But here's what's starting to trend in the news.
Yep.
The question is, with the pandemic, are there any additional risks by putting the influenza in your body, given the fact that COVID's going on right now? So that is something we're starting to see in the news, and I was wondering if you could weigh in on that question.
So it's a great question, and there will be lots of speculation over the next few weeks about this particular topic, I'm quite sure. And I welcome anybody to send me an email or a text message, and I'll share my number at the end, so that if they have specific concerns, they read something on the internet, and they want another opinion on that same topic, I'm happy to personally address those. Because I'll tell you that the science that I've read so far does not suggest that anybody should hesitate at all to get a flu shot this year because we're in a pandemic. It's quite the opposite, right? Because we're in a pandemic, if in prior years you've been hesitant, or you forgot, or you just didn't make a plan to get it, or this is the year to not do that, right? This is the year to definitely get a flu shot. I would say that people have speculated, right, that because we're wearing masks and we're physically distancing from each other and we're washing our hands, that the precautions that we're taking for COVID-19 should also reduce the circulation of influenza, in the community. So some people have thought, like, well, maybe we don't need a flu shot this year because, well, we're not interacting a whole lot with each other, so the probability of disease transmission is much lower. But I would say when you start to look at the real data, and we've seen the case escalation, in Missouri and frankly, most other states recently, we might believe that those public health precautions that we're taking are not that effective right now. And we need to use every possible intervention that we have available. And the safe flu vaccination is one of those interventions that we that we should, embrace with open arms, at least for most people, right? So there are folks that have medical conditions, for example, that a flu vaccination is not recommended for them. And those folks know who they are. They should consult their physicians or medical professionals for that specific guidance.
So Eric, with that, as you know, Missouri Healthy Schools really focuses on providing resources for K through 12. Obviously, we're concerned about the students, the faculty, the teachers, the administration, and of course, the staff. And with that, what advice or what best strategies would you offer to our school officials and leaders as we're heading into the flu season?
So hospital executives, physicians, public health departments are all doing everything in their power right now to promote flu vaccination. But schools have a very important role, leadership role in the lives of families in communities across Missouri. So I recommend that superintendents and principals, roll up their sleeve and show that their communities that they're getting a flu vaccination. Right? Share a post on Instagram, Facebook, Twitter of yourself getting, a flu shot. Promote it to your teachers, to your staff, to your families, that this is a safe intervention or a safe thing to do this year. And it's really important that executive sponsorship, that leadership sponsorship in a community by somebody we know that's is incredibly powerful to motivate people that are just thinking about getting a flu shot and maybe would not have done it in a prior year. I think that's number one. The second, from a school leadership perspective, is make it convenient. Do what you can to bring the flu shots to the people, right? Yeah. Making it extra convenient for people to get a flu shot. It could be, having a flu shot clinic set up by a local pharmacy or a healthcare system, like at the school, right? Maybe it's the drive-through variety where people just stick their arm out the window. That's one way. Or it could be, having, indoor sort of ways for people to do that, or vouchers, right? So the school gives vouchers to families or to their employees to say, this voucher is good for this pharmacy, to go, they're willing and ready to give you a flu shot today. And so those are a couple of the things that we recommend doing that. The other part I would just also is, as people are thinking about their role as health promoters, right? So some schools will think about things like mandatory vaccination coverage, like colleges and universities are thinking about this, right? It's hard to imagine that many superintendents would require a mandatory flu vaccination, but one of the things that you can do, right, is put all of your effort in health promotion to make sure that people know where to get it, how easy it is to get, and use your leadership position to demonstrate that it's safe and effective.
Yeah, Eric, that's a very, very powerful response and very helpful, strategies for us to consider. So with that being said, here's my last question. Okay, I know you're probably going to say now, but let's just be realistic, right? Because, if we're throwing out these strategies that certainly school districts can, employ, what realistically is the time frame really to get the program rolling where people can get the flu vaccination?
So get your flu shot now, right? In this little vial, right, that you'll go and is an amazing benefit that can be for you personally and the community at large, right? We had talked about the two main reasons that you should get a flu shot. And I recommend that you do it now. And but we've got a few weeks, really, to be honest. So if I had to give a deadline, right, I might give to students, right, in a class or something, like before Thanksgiving.
Okay.
Right? Our social interactions as a society will shift as we enter the holidays, right? Hopefully, folks are gathering in much, much smaller groups than we would have done last year because of the pandemic. But nonetheless, we're going to interact. Socialization is going to happen to some extent, during Thanksgiving and Christmas. Let's go into the holiday season clearly vaccinated for influenza and practicing all the public health precautions that are necessary to keep us safe from COVID as well. So let's go with Thanksgiving, but I'd say we have a two to 4 week window right now, to do everything we can to make a plan and promote flu shots heavily in the K-12 space.
Absolutely. So Eric, what I'd like to do to kind of close out the broadcast is just give you the final word. And do you have any other suggestions or helpful tips that maybe we can do to kind of prevent the flu?
Right. So one of the things that I advocate all the time, long before we were in this pandemic, right, is washing your hands is one of the most powerful things that you can do to prevent COVID, right, and to prevent influenza. And so I'll sign off this particular webinar doing one of my favorite things that I like to do, which is wash my hands, usually with soap and water, for 20 seconds. But I don't have a sink near me, so I'm going to use my handy hand sanitizer with a couple big squirts. Very generous with it. Rub your hands thoroughly, and sign off and wish everybody, just the best of health over the next few months. So thank you very much, Guy, for letting me promote flu vaccinations and encouraging school leaders across Missouri to do everything that they can to increase the flu coverage, right? Flu vaccination coverage in their communities. Thanks.
Eric, we just want to thank you so much. Hey, you brought this up. You gonna give me your contact information?
Oh, yeah. So you can reach me at mobile number. You can send me a text message, 314-307-5162, or email Eric, E-R-I-C, Armbrecht, A-R-M-B-R-E-C-H-T, at SLU, St. Louis University, .edu. We'll make sure that that's in the tag or the description below. So thank you very much for the opportunity to be with you, Guy.
Absolutely. Eric, I want to thank you again. Great information. Again, guys, we've been just closing up our discussion on considerations for the flu season. We want to thank you guys again for watching yet another edition of Mo Health Media. For Dr. Armbrecht, I am Guy Danoff. We want to thank you guys for watching the special edition broadcast.